Welcome to I Am Crypto, your go-to channel for the latest and most fascinating developments in the world of technology and finance. Today, we're diving into a groundbreaking topic that's making waves in both the medical and tech communities. Imagine a world where your cough could be the key to diagnosing life-threatening diseases. Sounds futuristic, right? Well, the future is now, and it's being led by none other than Google AI. Let's explore how Google's new Health Acoustic Representations model, or HERE, is revolutionizing healthcare by simply listening to the sound of your cough. The power of a cough. Let's start with the basics. A cough might seem like a mundane, everyday occurrence and annoyance during cold and flu season. But what if I told you that this simple reflex could be packed with information about your health? We're not just talking about identifying a sore throat or a cold, we're talking about detecting serious respiratory diseases like tuberculosis, TB, and chronic obstructive pulmonary disease, COPD. Traditionally, diagnosing such conditions requires a slew of tests, doctor visits, and often a lot of waiting. But what if a cough could cut through all that red tape? What if a simple sound clip could replace the need for invasive tests? This is where Google's HERE model comes into play. Introducing HERE Health Acoustic Representations. So, what exactly is HERE? Google launched this bioacoustic foundation model in March, and it's designed to hear specific health-related sounds, especially respiratory sounds like coughs. But it doesn't stop there. HERE was trained on a whopping 300 million pieces of audio data from a diverse and de-identified dataset, and when it comes to coughs, the model was trained using around 100 million cough sounds. That's a lot of coughing. But why is this significant? Well, the model learns to recognize patterns in these sounds that could indicate health issues. For example, the tone, pitch, and pace of your speech can reveal more about your health than you might realize. It's like having a doctor in your pocket, one who's always listening and ready to flag any concerns. How it works, the science behind HERE. Now, let's get a bit technical. The HERE model works by analyzing acoustic data. Essentially, it's listening to the sounds of your body, just like a doctor would with a stethoscope, but with a much higher level of precision. The AI then discerns patterns within these sounds that are indicative of specific health conditions. Google's research director of engineering, Shravya Shetty, mentioned that HERE outperforms other models in a wide range of tasks, particularly in generalizing across different microphones. This might sound trivial, but it's a huge deal. The ability to accurately analyze sounds recorded on various devices ensures that the technology is accessible to people all over the world, regardless of the equipment they have. Real-world applications, a game-changer for India. Let's talk about how this technology is being applied in the real world. In India, a respiratory healthcare company called Salsit Technologies is utilizing HERE through its Swasa app to analyze cough sounds and detect tuberculosis. This is especially important because TB is a major health issue in India. It's a treatable disease, but millions of cases go undiagnosed each year, often due to the lack of convenient access to healthcare services. Improving diagnosis is critical to eradicating TB, and AI is stepping up to the plate in a big way. With tools like HERE, healthcare providers can offer low-impact, accessible screenings that could potentially save millions of lives. As Jijin Chin, a digital health specialist with the Stop TB Partnership, said, this technology is breaking new ground in tuberculosis screening and detection. It's a promising development that could make a significant impact in countries where TB remains a major health challenge. The broader impact of AI in healthcare. While HERE is making headlines for its ability to detect TB, it's part of a larger trend of AI being used for early disease detection. This is not just a one-off application. In fact, AI models are being developed worldwide to tackle a variety of health issues, including cancer. For example, researchers at the University of Cambridge in the UK have developed an AI model called eMethylNET. This model has the potential to detect, diagnose, and determine treatment for cancer at its earliest stages, when it's most crucial. Imagine knowing the exact nature of a tumor before the biopsy is even done. That's the level of precision we're talking about. And it's not just academic research that's pushing these boundaries. Companies like Ezra, based in New York, are using advanced imaging and AI to scan vital areas of the body, including the brain, lungs, liver, and prostate. The goal? Early detection. Dr. Daniel Sodikson, a medical advisor at Ezra, pointed out that early detection can significantly increase survival rates. In some cases, catching cancer early can improve 5-year survival rates from 20% to 80%. That's a staggering difference. The ethics and future of AI in healthcare. But with great power comes great responsibility, right? As promising as these developments are, they also raise important ethical questions. How do we ensure that AI is used responsibly in healthcare? What about data privacy? And how do we handle false positives or negatives in AI-generated diagnoses? These are questions that the medical and tech communities are actively grappling with. The potential benefits of AI in healthcare are enormous, but it's crucial to navigate these waters carefully. After all, we're talking about people's lives here. Moreover, there's the challenge of making sure these technologies are accessible to everyone, not just those in wealthy countries or regions with advanced healthcare systems. AI has the potential to democratize healthcare, but only if it's deployed thoughtfully and equitably. Humor and the human touch in tech. Now, I know what you might be thinking, this all sounds a bit heavy. But don't worry, we haven't forgotten the human touch. In fact, one of the most exciting things about AI in healthcare is how it can free up doctors and healthcare providers to focus more on patient care and less on routine diagnostics. Imagine going to the doctor and having them spend more time talking with you about your health, and less time crunching numbers or analyzing test results. That's the kind of future we're looking at. And let's not forget the irony here: AI, which is often criticized for lacking empathy, is actually enabling healthcare providers to be more human. It's like the old joke, I told my doctor I broke my arm in 2 places. He told me to stop going to those places. With AI handling the heavy lifting, maybe doctors can spend more time telling bad jokes and making us feel better in ways that only humans can. Conclusion: the future is now. As we wrap up today's deep dive, it's clear that we're standing at the cusp of a new era in healthcare. Google's HERE model is just one example of how AI is transforming the way we diagnose and treat diseases. From coughs that reveal hidden illnesses to AI models that can pinpoint the exact nature of a tumor, the possibilities are endless and incredibly exciting. So, the next time you or someone you know has a persistent cough, remember that it could be more than just a nuisance. It might just be the key to unlocking a new level of healthcare, powered by AI. And who knows? In the future, your smartphone might just be able to diagnose you before you even realize something's wrong. Now that's something to cough about. Thank you for joining us on I Am Crypto. If you found this video informative, don't forget to like, share, and subscribe. Stay tuned for more insightful content as we continue to explore the intersection of technology, finance, and everything in between. Until next time, stay curious and stay informed.